And now that colder weather is moving in, health officials are warning that COVID cases could spike once again. Our chief health editor, Dr. Partha Nandi, joining us now. And Dr. Nandi, why are experts saying there's a possible COVID threat looming this winter?
There's several factors, right, that could set off another COVID spike. First of all, the colder it gets, guess what? The more people spend indoors. And also, two huge holidays are coming up, right? We know Thanksgiving and Christmas. That means families and friends, understandably, will be gathering together. And the more folks gather together, the more opportunity for the virus to spread, especially in rooms without good ventilation. Now, let's look at U.S. case numbers. Nationally, Glenn, the case numbers were dropping, but then the decline stalled. Right now, the 7-day average in the U.S. is just over 74,000 cases a day. That's pretty high. Plus, there's been a 17% increase in the number of new COVID cases since mid-October. That's because several states have seen increases in numbers. In Michigan, right, our case numbers have steadily increased, and our 7-day average currently sits around 4,500 cases. And Vermont and Maine are also seeing case numbers rising, with Vermont seeing a 50% increase in the last 14 days. And when you combine all these things together, right, cold weather, more time spent indoors, holidays, people gathering, and a highly contagious variant, and case numbers rising, in my opinion, this can be a recipe for more trouble and really a disaster looming.
So in looking at cases, speaking of across the country, is it surprising to see that COVID cases are surging in Vermont? I mean, that state has a high vaccination rate. So does that mean the increase is due to the waning immunity of these vaccines?
That's an excellent thought, right, Glenn? Overall, the Northeast states in general have a high vaccination rates, and Vermont in particular has 72% of its population vaccinated. So why then are we seeing cases surge? As you suggested, the waning immunity is likely contributing, especially with folks who have underlying health conditions, right? So on the plus side, a recent report finds that vaccine, again, still matter. Americans who have not been fully vaccinated reported infection rates rather, that were 3.7 times higher than fully vaccinated people. And 67%, right, 2/3 of people who were hospitalized in the last 7 days were for people who had not been vaccinated. Another huge contributing factor is that 40% of the US population is not fully vaccinated. And this means there are pockets of areas all across the US where the virus has plenty of opportunities to spread. And this is not good, because already hospitalization rates are on the rise. Another 2,000 people were admitted last week. So now, our national total of patients hospitalized, Glenda, is 47,000. So I'll stress once again, if you can get vaccinated, please do. If you're eligible to get the booster, we're talking about Vermont. If you're eligible to get the booster, I recommend you get it as well. Vaccines are our best tool against surging case numbers, and will go a long way to keep our families and communities safe. And if you are vaccinated still, and you're around people that are not, still remember, masking and social distancing is important for those folks, and so we will do everything we can to get this virus down, and if we get people vaccinated, I think we got a much better chance of controlling it.
All right, Dr. Nandi, thank you so much.
My pleasure. Thank you.
And don't forget, you can watch the Dr. Nandi Show this Sunday. Dr. Nandi is tackling HIV and cancer diagnosis. Again, that's this Sunday, 5 p.m., right here on 7.